Welcome to Startup Health TV. This is a COVID-19 health innovation update. I'm Logan Plaster with Startup Health, and I'm here today with Sarah Davidson, founder and CEO of Resility. Sarah, thank you for taking a few minutes to talk to me today.
Thanks, Logan. I'm excited to be here.
So Resility works in the science of resilience. And so I was very excited to talk to you and really hone in on not just the product that you have, but how you've applied it during COVID-19, because I think it's safe to say that looking inward and sort of assessing our own resilience, there's never been a time in my life when that has been more front and center. How am I handling this kind of crisis? So excited to hear about the product, how you're thinking about this time. So maybe you could start by just giving me the quick 30,000 foot view of what Resility is, what you've built.
Yeah, absolutely. So Resility is all about teaching families how to be more resilient in today's world. And I know resilience is kind of a buzzword, but what we really think about resilience is that power to be able to bounce back and handle any adversity that happens in your life. Because we all know we're never going to get rid of our stress. There's always going to be stressful things that happen. But what we have the power of, and really resilience is like, I consider it like a superpower, is our power is to be able to manage how we react to that stress. We talk a lot in our programs about the fight or flight instinct. We know that when you're constantly triggered by events that are stressful, and very frequently in today's world, it's just thoughts about things that are stressful. What might happen? What could I have said? And so those things, unfortunately, trigger that fight or flight response in our body, which is very healthy. It's designed to save us in times of danger and when there's, lions lurking behind a rock. But unfortunately, that constant flush of cortisol and all of those physical reactions cause a variety of physical and mental health problems, especially when it's triggered constantly like today.
Sure.
And so as you mentioned, in this particularly stressful time, there's much more uncertainty. We're kind of entering a whole new world that nobody's really seen in our lifetime, on top of everything else we already had in our daily lives. And so there's a lot of disruption, a lot of fear, a lot of uncertainty. And that's where we are excited, because what we've built and what we're continuing to build can really help people at this time when they really need it.
Okay, so we can get into then what you actually have built, because when I think of resilience training, I immediately think of just straight therapy. If I'm an anxious person, I talk to somebody one-on-one and deal with how to deal with my stress. But Resility is a health tech company and you're working at scale. So how does that work?
Yeah, so there's really three main areas that, things that we offer. And the core is really our training exercises and our stress tracking. So that's all done through our app. So it's all very convenient, very short, very easy to use. We've got some free exercises in there. We've expanded that, the free exercises that we're offering for the COVID-19 period to help people more. I'm going
to pause you right there and just give me an example of what that might look like. If I'm using your app, your interface to learn habits that help me improve my resilience, what are we talking about? What does that look like?
Yeah, so what we have is we do assessments of people to kind of see where their starting point is as part of our programs. But the training exercises are designed to be personalized for each person, because we know the same thing doesn't, and we have stress in the app too, so you can see over time, what your stress triggers are. There's a mini journal in there. And then the second piece of what we offer is personalized coaching programs, and that's where the coach can help you to figure out which exercises and techniques are working the best for you, help you build new habits. So we really look at teaching resilience very much like a new diet or fitness program. Let's just say a fitness program. When you want to get in shape, you first have to go out and you kind of have to assess your starting point, and you have to figure out what are the right exercises for me. Maybe I have, an old shoulder injury and I shouldn't be doing, overhead presses, something like that. So we help figure out what are those exercises that are right for that person. After you practice and learn these new skills, then we help you find ways to just integrate that into your life, because, we know that, mindfulness is very effective, but nobody has time to do like an hour a day of meditating, right? Sure. So what we look at is how can you make little lifestyle changes taking little mini breaks. If you can just bring your body back to that calm, cool, relaxed state, it's just like stressing a muscle and then relaxing it. That's how you build up that resilience in your muscles. That's how you build up that resilience in your body. So our coaches help with that. We have virtual coaching. It's done through messaging with the coaches. And we also provide some products that support resilience and self-care.
I saw that on your site that you were starting to do a box. I thought that was very interesting.
Yeah, we launched the self-care toolkit right before the holidays last year because we had a lot of interest, and it's all products that help support resilience, that help provide tangible tools to help people, encourage people to make that time and take that time for self-care. And so we had a great response to that. And we, as a result of that, have decided to launch a subscription program. So it will be a subscription box offered quarterly. And so in addition to getting access to the personalized training exercises through our app, you can then get 4 times a year, you get a box that has, again, support tools that help you. And it really helps to provide those triggers. You don't always, to build up your resilience, you don't always have to be sitting doing conscious exercises. Most of ours are designed to be, 10, 15 minutes maximum. But once you sort of build these skills, you can find other ways just to take a couple of minutes throughout your day to be able to get yourself back to that state.
I'm going to take advantage of your time as an expert in this area and put you on the spot and say that I have 2 children who are 6 and 4. And I often think, how can I better train them to be resilient human beings? What advice would you give to me for ways to instill some of that in them?
Yeah, no, that's a fantastic question. And I will say our programs are really geared towards families, and we have a particular focus with teenagers. So a lot of our coaching programs are designed for teenagers and up. In the future, we will likely launch programs for younger children. But with that said, there's a lot of, there's a lot of the same skills. This can be taught starting at a very young age. And I have an 8-year-old, and I have to say, in today's world, they're just exposed to so much, and it's amazing. Some of the things that kids will come up with, like, my son's going into 3rd grade, and he's like, I don't want to go there because I'm afraid of the testing. And then he starts, some of this negative self-talk that we all do, but it's really important to be able to, especially when they're young, to get that into, how do you change that habit of, instead of, saying something negative about myself, would you say something about yourself that you wouldn't say to someone else? So I'm teaching those lessons to my own son, but you can do little short exercises, training exercises, breathing exercises. There's a lot of fun ones for younger kids out there. But I think the self-regulation, the ability for kids to recognize those emotions and process those emotions in a healthy way. And an important element of that is having those social relationships, that are trusted with your family members, in a younger kid's case, or when you're older with friends. So if they're feeling some, emotion, that's okay. It's fine. You want to be able to have them be willing and not just, kind of tuck that away and ignore it, right? Because that's when things build up. And that happens with all of us, right? I've always been kind of a hard charger. I just, push any problems or adversity to the side, and I just keep going forward. But I actually hit a point in my 30s where it really just caught up with me. And it caught up with me with a lot of physical problems. So I had a lot of health problems. Neck pain was probably one of the worst that I went through. But it took a long time and a lot of trial and error for me to understand that relationship between my thoughts and my feelings and my stress response and what was physically happening in my body. And that's a really important lesson that we try to teach the teenagers, especially. We have an advanced program that uses a biofeedback tool, so it measures muscle tension, so they can actually start to see, as they're doing an exercise or they're doing an activity, what is causing that tension to increase. And that self-awareness, and through these tools and skills that we're teaching, the ability to start self-regulating, is so critical throughout our entire lives.
What is that biofeedback tool? What kind of information does that give you?
So that measures muscle tension, and so we use it primarily for our exercise on the shoulder. So you can see how sometimes, and this is the big aha moment for
Like
the
if
people
I'm,
who used it. Exactly, you're gonna wait a minute. I mean, I used to have my shoulders up around my ears. It wasn't until I had done that biofeedback training that I realized. I mean, I couldn't get them down. I would shove them down, but it was still.
wow, yeah,
And posture, it's like if you're holding yourself in the wrong place, those muscles get tense, and at the end of the day, you've got pain, and go through weeks and months and years of that, and it becomes chronic.
yeah.
So that teaches people how thoughts and feelings and not paying attention, not noticing what's going on, how it really affects your body, and that connection between the mind and body is another key piece of
Hmm.
really our value prop to people, because awareness is the first step.
We're in such an interesting time with virtual care and just the rapid adoption of not just telemedicine, but all virtual healthcare. And so, just thinking about the market in general, it sounds to me like Resility has pieces of kind of the more direct-to-consumer meditation apps, which are kind of exploding, and then on
Mhm.
the other side, you have uh, teletherapy, and you have direct to um, mental health professionals. And would you say Resility kind of operates in like a kind of a middle ground that kind of pulls from both sides of that, and kind of bridges the gap between just the meditation, what calm or whatever would
Right.
be on one side, but then
Mhm.
you're adding in the science of resilience, dealing with anxiety is the other side of that. So kind of more towards the science of it.
Right. No, absolutely. I think that's a really good description of kind of where we fit. There's always going to be a need for therapy, psychotherapy, and for different use cases, right? And different mental illnesses and problems. So we aim at all to take the place of therapy. What we do know, because we have developed relations with a lot of therapists as well as our own clinical team, we know that therapists and counselors are trying to teach their patients these same skills that we're teaching as part of their practice, right? So they're often recommending apps or programs or things outside of what they can do in the face-to-face session, because they can teach you something, but it's really the practice and the repetition that makes that become an actual skill that you have. And we really know that resilience is a skill that everybody can learn, which is great news, right?
Yeah.
Sometimes we think, oh, I can't take it, but we all can, and we can learn things that make it easier for us.
Got
So
it.
yes, we definitely fit in that space. And we know from talking with parents and teens and pediatricians, the therapy can be an obstacle for a lot of people,
Mm.
whether that be financially, whether that be time, inconvenience. Sometimes kids don't want to go. I mean, even adults, right? Probably a lot of folks have had some kind of counseling, and you really have to find the right person and click with them. And if you don't, it can be, it's just trial and error. So we try to take a lot of that trial and error out, and we try to, let's make this convenient and easy for people to learn and do in their own time, place. And then we add in the coaching to really help drive that behavior change, and have somebody that can look at what you've been doing and help assess how has that been working, and how can we make it work better for you in the best way that fits with your life.
So the coaches become more like life coaches at that point than therapists.
The coaches
Um,
are really focused on behavior change.
okay.
Yeah.
Talking you through, okay, you said you wanted to do X. You wanted to, what would be a good example of a module you might work through in terms of a behavior change?
Yeah, no, I think that was a good example, because we start with goals, right? What
Mhm.
are your goals? How do your goals align with your values?
Mhm.
Because we know from the science, right, of building new habits, that's what makes people stick with something, right? People that are overweight, for example, often know they need to lose weight, but when something happens and they know, okay, I got sick and I have to be here for my family, that's when it drives their behavior change.
Okay.
So our coaches work to help set goals that are very integrated with your values and aligned with your values, and then look at your lifestyle and then look at the response, because when we use the biofeedback, we can also measure somebody's response to different exercises and techniques. And so the coaches can help interpret that. And as we continue along, the algorithms will do more and more of that interpretation as well, as we continue to grow.
Got it. Obviously, and we've touched on this at the beginning, but obviously we're having this conversation in the middle of the coronavirus pandemic. And you're talking about a platform designed to help people cope in these kind of situations. So what kind of feedback have you gotten from users over the last couple of months? How have you seen use of the platform change? How are things evolving for you?
Yeah, no, that's great. I mean, we've definitely seen an uptick in use, because we know this is it's based on need, right? When there's more of a need, and I think the need is there, but people are recognizing, right? Because when things come a little bit to a crisis point, you're like, okay, now I've got to do something. So we've definitely seen an uptick. We've also been putting out a lot of resources for families and for parents. Kids get, they have fears. They're afraid about this virus. Even my young child, the virus he talks about, but it's this big scary thing. And what if I get the virus, right? And kids that were in school and now they're isolated, they're separated from their friends and from their family. Social isolation, as I'm sure you know, is a huge problem and really can aggravate, someone's mental health state, right? So if you have issues, the best thing is really to be able to have those safe social connections. And if you're isolated and separated from the people that support you, that's really going in the wrong direction. So we're seeing, and I'm sure you've seen a lot of press about the increase in mental health problems or exacerbating conditions that people have because of this. So we've been providing a lot of free resources. You can find them on our blog for parents, schedules for teens that would help put them into a routine, and activities that they can do. We've put out some more content, more exercises, as I mentioned. We're putting them out on some new platforms. We've got a podcast on SoundCloud that you can access our exercises. And then we launched this personalized program for frontline workers. So an 8-week digital coaching program for frontline workers, because we know, everybody has challenges right now, but some of these frontline workers, they're working long hours. They're under a lot of extra pressure. They often do have kids at home that are now being homeschooled. And, it's a juggle, as you know, as a parent, right? How do you balance all of this stuff? And it's really important for their well-being that they find ways to deal with this. And, this is just the time. I think there's just a greater recognition of the need right now.
What kind of suggestions do you give to a frontline worker who's just burning the candle at both ends? They're probably thinking, I don't need life coaching. I just need a babysitter. I just need
Right.
eight more hours in my day to work and to sleep. Like, give me an example of a strategy you'd give somebody in that situation.
I think the biggest thing that people have to understand is that you don't have to start big. Start small. Start very small. You can make a difference in your body and your mindset in as little as 5 minutes, 10 minutes, right? So don't feel like it, because it just becomes one more overwhelming, I have to go learn something new. No, we're going to teach you things in very short bites. And literally you can think about your body right before you start, do a 5 or 6 minute exercise, think about how you feel afterwards. And that is going to increase that awareness that I was talking about earlier. We also refer to it as interoception, that sense of, really being more in tune with your body, which is highly correlated with mental well-being, right? So don't get overwhelmed by having to add something else to your plate. Just take 5 or 10 minutes for yourself and try some of these things. If it's not our tools, there's definitely other free tools that you can get access to. As you've mentioned, some of the apps available, but start somewhere and know that you can make a difference with just a tiny bit. Don't add that, oh, I'm not doing enough, I should be doing more. No, just do something. And that's, again, another piece of how do we build habits, right? You don't want to, if you did want to build up to an hour meditation practice, it's too much to bite off at once, right? So you start with, how do I do that for 2 minutes, right? And then get that habit, find the times in your day, find the triggers that get you there.
I have found that to be so true personally, that just the breaking through and forming one habit can convince you that you have the ability to change habits. For me, it was the simple habit a year ago of drinking more water, which I knew was a huge problem. I was drinking like zero water. And I didn't realize until I finally made it a habit over like 90 days that I really was struggling with the belief that I couldn't change my habits. And it wasn't really about the water. It was this idea that you really can't, get out of this rut. And the minute that I realized that I had done it, I felt like a world opened up to me, like just the simple idea that I can change. And so it's been very, very real to me. I could see how that just like coming up with a 5-minute success would be the entry point.
Yeah, and finding ways that work for you. So I drink a lot of water, and I have for a long time. But years ago, when I kind of started the habit, and I still have it, I have a giant straw, right? It's kind of remember when McDonald's went to like the big drinks and the big straws, and you drink so much more. So like finding little things like that,
Hmm.
in our case, just to use an example from what our coaches might help you with, it's like while you're brushing your teeth, can you take a moment to feel the brushes and taste the mint and the flavor? Like it's just that awareness of and getting more in tune with what's happening in the moment. Those little things don't take time, but if you can use a trigger like brushing your teeth to get into these little habits, then it starts to cascade and it becomes easy and not a burden.
Interesting. Very interesting. Well, Sarah, that's the time we have. I really appreciate you really explaining the platform and kind of where you're heading with me. If someone wants to learn more about Resility, partner with you, what's the best way for them to do that?
Yeah, absolutely. So our website, resilityhealth.com. Our blog, as I mentioned, has a lot of these new resources that we've been putting out and links to that. And we have our Resility app on iOS and Android. So please feel free to download that. We've added more complementary exercises. And if not, please, anybody that's struggling, I really do encourage you just to start small, find something that works for you. There's plenty of resources out there. We try to make it, make a very simple entry point and make it easy for you. But I just encourage people to take a tiny bit of action that's really going to pay off for you. But definitely reach out through our website, and we'd love to connect with you anyway.
All right. Thanks, Sarah. I will be taking that to heart myself.
Thank you so much.
Have a good one.